Yeah, for the last 5 years, St. Ghana's main objective in terms of its health program has been to improve access to healthcare, especially for the poor and the marginalized groups. Improving access to healthcare means two things. One, we want to reduce as much as possible financial barriers as well as geographical barriers. So in terms of financial barriers, our main focus has been monitoring the NHIS to ensure that those people who are poor and vulnerable, and for that matter cannot pay for the program, have access to the NHIS. And we've been working with the NHIS, especially in the area of indigent registration. We've been able to facilitate a number of them through our advocacy to have access to be registered as indigent. What I mean by indigent here is that because they cannot pay for the premium, the policy allows that such people should be registered once they identify as poor and now they cannot pay for the NHIS. So we've worked with the NHIS to ensure that thousands of poor and vulnerable groups have actually benefited from the NHIS.
I think for now, one of the most important interventions that St. Ghana has is the USAID funded People for Health project, which is an integrated project that works with people with HIV and AIDS, key population, mothers groups, the under 5, to address and improve their access to quality health services. We do that by budget advocacy. We do that by promoting the patient charter. We do that by promoting the code of conduct. All of these add up to increasing their awareness of their health rights and enabling them to demand for quality health services.
4 years ago, we implemented a social accountability project aimed at improving education and health service delivery in selected districts, ensuring that there's transparency and accountability in the utilization of resources for improved health services. In this project, we had worked with district assemblies and the Ministry of Finance, the Ministry of Health, to ensure that they allocate resources for healthcare delivery, particularly at the district level. We organized a lot of budget sensitization, just so that communities, selected communities who benefited from these interventions would know their right to participation in the budget process, would know and also have information concerning their budgets. Those were platforms that citizens used to make their requests. Most of them are in remote places. They cannot travel to the district assembly at the capital of that district to go and make their inputs into budgets. So that was a good platform for them. We did not do this as SEN alone. We collaborated with the district assembly. We only facilitated the process and getting the district assemblies to come and share budget information with the communities. So this enlightened community members as to how much resources the assemblies have, what they intend using the resources for, and how it was going to benefit them. And they use that opportunity to also make requests for their pressing needs in terms of health.
My name is Ali Adams, the community of NICE in JD Chips, and I also double as the CO2 for the chip compound, who serves close to 7 communities. Before we partner with St. Ghana, many of our communities were cut off areas. They were very far from the facility where we render services to them. So usually what we do is to render mobile services to them.
Another area that we've been able to at least achieve good results is community involvement. It has been a challenge, even though the chiefs recognizes the role of community in the implementation of the chiefs program. So through our sensitization effort, we've been able to sensitize communities to support them to also come out with action plans which they are now implementing. We go to some communities now, the community health management committees are now up to their roles. For instance, in the Eastern region, we have a community called Jikiti. For the past years, they've been trying to get a chief compound. It has been very difficult for them. Through our intervention and the sensitization that we carried out, an action plan was developed by the Community Health Management Committee to ensure that at least within the next 1 or 2 years, we have a chief's compound. Through our effort, we were able to support them to write a letter to the assemblies, followed it up, and then, the assembly responded positively, and currently they are building a chief's compound. It's at the roofing level for the community.
The community took the initiative to construct a mobile chief compound where the services will be closer to them, and there will not be the need for them to travel far distance to access quality healthcare at JD Chips. And before the community took up the initiative to build a mobile chief compound, there were so many challenges they encountered because number one, the community was very far away from the chief compound where services, especially deliveries, ANC, CWC services, treatment of minor ailment, and the rest were only rendered to them on a monthly basis, where we go there for outreach services to give them these services. But after the sensitization and the community saw the need for them to get their own clinic to them, it has helped improve many of our indicators we work with, especially our ANC registrants has increased. Our deliveries, usually we don't record home deliveries from Chase anymore. And then all the other EPI indicators have also improved due to the fact that the community herself took the challenge to construct a mobile chief compound for themselves.
OSEN has a long-standing partnership with Ghana Health Service, with the Ghana East Commission, especially for people for health, and with the health service at district and national level. And I think that our partnership at all levels so far has been very good. We've been able to add value to the work of Ghana Health Service in delivering health services to the people. Our work has also benefited from the work that we do with Ghana Health Service. They be a good resource partner to us, especially when we do monitoring all the technical services that are provided by Ghana Health Service. I think for us, an important message is that the access of disadvantaged people like key population groups, people living with HIV and AIDS, those who live in very isolated parts of Ghana, making their voices heard, giving them the patient charter so that they can be able to exercise their health right is an important advocacy message for us in order for us to make sure that no one is left behind and that everybody's health rights are respected. So for us, our message on this day is to make people aware of health rights and to encourage them to exercise their right to quality health care.
The country's wealth creation depends on a healthy population. If the citizenry are not healthy, they cannot be productive, and to enable government to generate the wealth that it desires for the development of this country. And therefore, it is very critical for government to allocate resources that are required to make health service delivery worthwhile, to improve on health service delivery in a manner that reaches everybody everywhere in this country. And we believe that if government should live up to this, we would increase our productivity as a country, and we begin to see significant improvement in our development as a country.
Well, I want to wish everyone who will have the time and the opportunity to listen to Saint message on this day. I wish all of us a happy World Health Day, and as we celebrate this day, we dedicate our efforts, our resources to making sure that everyone, especially the poor, have a right to health realized.